6 medical professionals from Maine are taking part in a study to expand access to treatment for HIV.
Ronnie Perillo explains how the work could help one of the most vulnerable populations in our state.
Housing insecurity, being unsheltered, the research shows is a significant risk factor for HIV.
Dr. Alex Karoglian is chief of Maine Health's Behavioral Health Unit and one of 6 leaders from the hospital system helping to develop a plan to treat the homeless population for HIV. It's something they're calling street medicine.
Our expertise in Portland and in Maine is being brought to bear on this federal initiative.
Over the next 3 years, the group will study ways that HIV treatments can be given to people living on the streets or without reliable housing. It's already being done in other locations across the country.
It's one way to meet people where they're at, to go where the individuals and communities are whom we serve. We don't limit it in terms of its availability to people who are sleeping on the streets night after night. It's something that makes care accessible to a broad range of people with varying degrees and forms of housing.
According to the International AIDS Society, 17% of people diagnosed with HIV or AIDS experienced homelessness or inadequate housing. Maine Health says these groups are several times more likely to contract HIV.
What is in your heart that makes you want to do this?
It's really our duty and passion to serve people who are marginalized, who are suffering, for us to get out and connect with people directly where they are.
The results of the study will be used to make recommendations for HIV and AIDS treatment on the federal level. In Westbrook, I'm Ronnie Perillo for Maine's Total Coverage.